All right, perfect. So we are starting. Good morning, everyone. I'm Professor Darlene Riggs. Welcome to Be the Drop. So Be the Drop is a nonprofit organization where we believe it's important to share our gifts, the gifts that God has given us, whatever talent that God has given you, to share with the community. I am a true Christian, and I'm doing this because I feel like it's a calling. Nurse, and I think it's a blessing and a privilege that God put me in this profession, and I really just want to give back. So this is a free review to help those of you who want to get into the nursing profession to get in as a certified nursing assistant. So in Florida, Florida is one of the few states, I think it might be the only state that allows you to challenge this exam without having to go to a school that takes a long time or school period and to just study and take the exam, which I think is pretty phenomenal. So I have the knowledge and I want to pass it on to you to teach you what you need to know to pass this test. So, welcome. First and foremost, we're going to pray because I believe God is in control. May His will be done above all will. So, Father God, we thank you for this opportunity. We thank you for this morning, for waking us up this morning. We thank you for your many, many blessings in our lives. I thank you for each and every individual that is on this free review today, that is on this Zoom, that will hear this lesson for however long you allow it. I pray, Father, that you would grant these individuals the desires of their hearts to enter this profession and to practice safely. Father, I pray that they'll have the time to dedicate to this, to study and to learn what they need to learn and be successful when they go to take this exam. But Father God, above all, we pray for their salvation. We know that we are not promised tomorrow, that your will be done. We don't know how long you give us on this earth. So we salvation. We pray that they will come to know you, Lord Jesus, as their Lord and Savior, and that they would not, die when they take their last breath in their sins, and that they would be saved and build a relationship with you and accept you as Lord and Savior. That is first and foremost. And second, Father, as again they desire to be in this profession, I pray for their success. I also pray for their families and their household, for the salvation of their families and their household. Father, we love you and we thank you for this day, for this opportunity. May all go well. May your will be done above all else. And it is in Jesus' mighty name I pray. Amen.
Amen.
Amen. All right. So we
Amen.
on the right foot. We're starting the right way. So let me go ahead and make this screen a little bit bigger so that I can start the teaching with you. So if you're just coming in, if Miss Nadine just let you in, welcome. I'm Professor Riggs. Thank you again, Nadine, for assisting. I appreciate that. And so many of you, thank you for joining. Again, if you have the desire
You
to
are most welcome and you deserve it.
I appreciate
Well
you.
deserved,
Yeah,
yeah.
it's awesome thing that we get to do this. So, everyone, I have a desire to pretty much help you get into the healthcare profession, and this is a great way to do this. So, there's two important entities you need to be aware of, and one of them is Prometrics, okay, which makes and administers your exam, and then the Florida Board of Nursing, which gives you all these rules and regulations on this exam. So I'm going to deviate to their website for a moment just so I can show you, and then we'll come back to the PowerPoint. So let's do Florida board first. All right, so this is governed by the state of Florida. So the PowerPoint, by the way, that you will have access to, you can just click on that link. It will take you to the website. I've already linked them. So I pulled it up for time purposes. So if you look here, this is brand new. Florida Board just updated their website. When you scroll down, you will see CNA right here. Okay, certified nursing assistant. This is the one that they allow you to challenge the exam without having to go to school. So let me show you that so that you don't think I'm making this up. So here on their website, you see how it says the state approved training program is not required prior to examination. So you don't have to go through an approved school. All you need to do is have a high school diploma or its equivalent, a GED, right? Be 18 years old. I assume you are all 18 years old. So even somebody coming from out of high school can do this. Okay, so that's all you need. Okay, you don't need to have gone to school and spend, hundreds and thousands of dollars, but you do need to learn the content, right? Because there is an exam that you have to take. So that's what I'm going to do is teach you what you need to know in order to take the test and pass it. Does anybody have any questions so far? Okay. How many of you are actually interested in doing this and are ready to learn what you need to learn and go take this test? You can just put in the chat. There's a chat button. Just let me know. Okay, how many of you are truly interested in this? Because I think it's such a good idea. And I think so many of you are not even aware. So, again, I'm on the Florida Board of Nursing. These are the guys who govern, and they're telling you applicants to become a CNA right here must successfully pass the required background screening. You probably already know that. You have to do a background check. They want to make sure that you're not a criminal and you don't have any Medicare, Medicaid fraud or anything like that. But you could either, yeah, go to school, complete a whole training, okay, or you could challenge the exam. Okay, so this is what we're doing here. We're instilling the knowledge in you for you to challenge the exam. Okay. You see here, a high school diploma or its equivalent or be 18 years old is required if the applicant is going to challenge the exam without going through an approved training program. Now, how many of you knew that? How many people actually knew that you could just challenge the exam? That you didn't have to go to school and pay all this money and spend all this time. Let me look at the
I
chat.
know that. Yeah, I
Okay,
know
so
that.
you say you do want to do this, you do want to do this. Excellent. And I'll be
Mhm.
glad to help you to do this. So perfect. Okay, so let's continue. So that's Florida. Okay. Now you're going to need to go back to this website and read all of this. They talk to you about the fingerprinting process. This is for your background check. You do have to go through a background check because again, you're coming into the nursing, the healthcare profession where you will have access to people's social security, date of birth, their addresses, their personal information. So you must go through a background check, okay? So you want to come back to this website and read all of this. So if there's some type of criminal history, this is where it tells you whether you qualify to take this test or not, because depending on what is on your background or your history, you may not be able to take this test. So that's where you would get that information. So if you've had any type of disciplinary action, this is where you would find out if you qualify. If you have some type of health concerns, this is where that information is. Okay, if it's fraud, if it's Medicare, Medicaid, this is where you would read those things. But I would tell you, yeah, if you have any of that stuff in your background, you definitely want to reach out to the board and find out, can I take this test? Because you may or may not qualify to do it. Okay. The process is all here. Obviously, you have to fill out an application. Okay. But again, you can fill out the application and on that part of the application say you want to challenge the exam, that you did not go through a traditional schooling and you're allowed to do that. Okay. You can do an electronic fingerprinting. So this is all of that information you need to know about the test. Okay. So that website is a great website to play with, to spend time with. It answers probably all of your questions. Now, as far as the fees, we're going to go to Prometrics to learn how much is it, how many questions are in the exam. So anything pertaining to the exam itself is going to be on Prometrics, okay? But the rules, the regulation, the process, that's all through Florida Board of Nursing, which the website is here. It's Florida's with an S. I don't know why they have an S at the end of it, but they do. So it's Florida's nursing.gov. If you can see my cursor right up here. Okay, Florida's nursing.gov is the website. Once you go on there, you just let me go home so I can show you because some of you just started. So once you go to Florida's nursing.gov, scroll down. Okay, scroll down until you see CNA. This is the exam you want to challenge, okay? You just click learn more, and this is where I was. Okay, it talks to you about the requirements for the exam, the background check, the application process. So now with the fees, we're going to go to Prometrics. Any questions so far with the Florida's nursing.gov section? You good?
We're good.
Awesome. So now let's go to Prometrics. So I pulled this up too because of time. So this website is Pro metric, metric.com. Okay. So when you go on Prometrics, so again, Prometrics, they're the ones, making the exam and testing you. So scroll down a little bit. They go through with you as far as the application process. You could do the application online or you could do a paper one. Obviously, if you do a paper one, you have to mail it, with a stamp. But the online one, you create an account, you fill it out online. So there's no paper trail. It's all electronic. So it's up to you how you want to do that. Okay. And then, of course, you have to do the fingerprinting, the background. And once they receive all of that, they'll let you know if you can test or if they need more information. But that's where you would go to physically fill out the application. Okay. So that's on prometric.com. There's a ton of resources here for you for the exam, about the exam. Okay. The testing center. Where do you go to test? Which one is closest to you? Okay. There's even example, question. There's the skills. So some of you wondering what type of skills would they ask me to do? All of that is here. My job and goal today is going to be to show you how much information you need to know. We will do some of that today, and then I will have future sessions for you to join me on, and you will have access to the website for you to continue the review and get to the point where you're ready to take this test. Okay. So I just want to show you a little bit of what you'll be required to do here. So I just pulled up the skills checklist. Some of you are like, what type of skills? What do we need to learn? This is it here. So they can choose any of these, okay, up to 5 of them and ask you to do it. Hand washing. So you need to know how to properly wash your hand. And this is what they're looking for. It's all here. But when we go through the whole teaching, I will be teaching you that. Okay, I'm just showing you right now what's coming up. Okay, emulating a client. How do you properly help a client get up out of bed, walk from one area to the other? Okay, the bedpan. How do you properly help someone use the bedpan? Okay, so these are some of the skills. There's a lot of them, but you need to know all of them because you don't know which one they're going to choose to ask you to do. Does that make sense, everyone? All right,
Yes.
awesome. So that's Florida Board of Nursing, that's Prometrics. And then once you pass the exam, you go in their registry where you can see your name, you can see your license number, and you can practice. Okay, so let's go back to the PowerPoint. So we've gone over Florida Board of Nursing and we've gone over Prometrics. You know what each entity does. Okay, again, those are the two you need to really be familiar with in order to go through this process and take the exam and pass it. Okay, so now I have the link here for you. So you will get access to this PowerPoint. And again, once you click here, it takes you to the website. I already linked it for you. Okay, the application process. Okay. If you want to learn more about the exam, how to develop it, you can learn all of that on Prometrics as well. I'm sticking to what you need to know today. Okay. So, like I mentioned earlier, there are 2 parts to the exam. There's a written or oral part, and there's a skill part. Okay, so the written oral multiple choice is 60 questions. You get 90 minutes to do it. Okay, and you get to sit on a computer, yeah, to take the exam. With the oral option, you get English or Spanish, okay? But either way, whether you take the written or you take the oral, you need to score 70 in order to pass, okay? The skill portion, that's the hands-on, where they tell you, show me proper hand washing, right? They get to choose five random. You don't know which one. You have 30 minutes to do them, and you're doing them in front of somebody watching you. You have to demonstrate, and you need to pass all five skills. Okay? So you're kind of in school with me. It's just you're not paying a whole lot of money, and it's not going to take you as long as it would if you were in a traditional, school. But you do need to learn the material and you do need to learn the skill. So there'll be some videos because obviously I'm not on ground with you face to face. Now they just changed the rules with this to where they say if you went through a traditional schooling and you take the test within 6 months, you don't need to do the skill portion, you just need to do the written part, which is that's fairly new, like months ago, not even a year old type of decision. Okay. So now, once you've gone through that, you've taken the exam, you pass it, you go into the Florida Nurse Aid Registry, where your employer, wherever you go to apply for a job, they can tell, yep, you're licensed and you can work. So, and that happens right away within a day or two after you passing the test. So it's not something you have to wait or long process. And that website has the information for you on how to renew your license, on your, education, and even, employment. So great thing to have. And it just helps you start a wonderful, career. And after that, you can, I would hope you'd want to go ahead and do the PN program, do RN, get your bachelor's, just keep going wherever God leads you with that. But this is a great start. So we've gone over the application and registration process. Again, you would need to create an account with Prometrics, fill out your application. You can do the electronic or you can do the paper, and the fees are on there. Okay. So with both exam components, it's $140 for the verbal and for the skill. And you can pay online, obviously. There's different ways you can pay. So once you go through that application process, you'll get to that section. And then once your background is cleared, you've paid, you've done your application, you will receive a letter that tells you you're eligible to test. And then you can choose your date. That's where you go into which center is closest to you, schedule your exam, and go take, your exam. So that's the process with all of that. Once you've done that, you need to, do a couple of things on the day of, right? For you to make sure you're prepared. So one of the things, make sure when you're filling your application, your name is correct or it's the same as on the ID you're going to be presenting at the center. Okay, make sure your email is correct because that's how they'll communicate with you. Um, make sure you're in clean scrub. These things we can address closer to the actual exam, but I just want to run you through a full process. You don't want to bring anything into the test. So some of this will repeat again closer to your testing time. Okay. And then after the exam is complete, whether you do the written part or both parts, and you can schedule the other part on other days. And if you need accommodation, they even do that. You can, receive accommodation. So there's a lot more that you'll see on the website that due to time we're not covering. But you can find out, the outcome within a day or two, whether you pass or not. Um, I know it could be a little bit nerve-wracking, this is important, this is a test, but it's absolutely worth it. I can tell you, think about how many people have done this, have gone through it. You absolutely can do it. You just need to learn the content, you need to know the process and go for it. You can work hospitals, nursing homes, any type of, healthcare center once you've obtained this. So I would say, even though we're getting to the part, whenever, students see results, you get a little nervous, but don't. You can and will do this if you truly want to do this. Okay. All right. So part of the beginning, the foundation, right? You need a strong fundamental base. Okay. which is rooted in medical terminology, your root words, your prefix, suffix. How do you break down the word and understand its meaning? Okay, so that's essential. It's going to be very difficult to get you to the point where you understand the question, you're answering the question, if you don't know the word and are able to break down the word. Okay, so this session, we're going to be exploring medical language. Okay, what is a root word? What does it mean when we say prefix or suffix, right? So there are elements in different ways to break down a word, but the more you build your vocabulary, because remember, this is a new language. Nursing is a language, healthcare is a language. The more you have vocabulary base, strong vocabulary base, the easier things are. Okay, so we're going to be breaking down hundreds of what we call, common medical words. And this is put in alphabetical order. That's another way that I decided to organize the information to help you better understand it. So this is in alphabetical order. The one of the most common, medical terms that you need to know and be familiar with. Okay. So here's the beginning part. What is the importance of medical terminology? So first of all, it's important for you to know how to properly pronounce, right? Be precise in your communication. So the reason why there is a language, right? There are medical terminologies so that we can communicate what it is that we want to communicate. We always want to be precise. We don't want people to be guessing what we're trying to say. That's why we all come together in this profession, in this healthcare field, and we speak the same language. The other reason is documentation. When we write something down, let's say 10 years later, we want to make sure that whoever's reading it, however many years later or long later, they understand what we meant. Okay, so using correct terminology ensures that medical records are precise, right? We say what we mean and we mean what we say. It also reduces errors. If we're all speaking the same language, we are less likely to make mistakes. Okay, and when we don't make mistakes, we help patients get better. So part of it is improving patient care. If we're all speaking the same language and we're precise and saying what we mean and we understand each other, less mistakes are made. So that's the reason for medical terminology. We want to be precise. We want to speak the same language. Okay. We want to prevent errors. We want to win this profession to make people better, not worse. Okay, so it is fundamental that you understand medical terminology. It's the foundation. Okay, it's a building block. So once you have a strong foundation, everything else is here. Okay, and we want to work smart and not hard. If you under my teaching umbrella, often you'll hear me say that. Work smarter and not harder. Okay? So that's our purpose. Now, how are medical terms structured, right? How do these words come together? How do we get a full or complete medical term put together? So each word has what we call a root word, right? The core of the word. Without it, there is no word. Okay? And then once there's the root word, what we put in front of it changes it. Okay, the beginning part of the word modifies the meaning of the word, changes the word. Okay, and so does the suffix, the ending. Okay, so every word has a prefix, a beginning that gives you the meaning of it. A middle part, the root, right? Like a tree has its root, its core. Without the core, there's no tree. And then there's a suffix, right? End of the word, which also changes or modifies its meaning. So there is a structure to words. There is a logical structure. We don't just wake up and make these up. They're done on purpose, hence the structure. Okay? So the words that you are going to encounter, they have a root, okay? A foundation. They are modified by a beginning, which is the prefix, and an end, which is the suffix. So here's an example. So most of you have probably heard of the word cardiology. So the root part of this word, okay, is cardi, which is heart. That's the root word for heart. Okay, and the suffix ology is the study. So cardiology is the study of the heart. And if we say cardiologist, we're talking about an individual who studies the heart. So you see how the suffix, the ending, tells me what's happening. So that's what we're going to do with a whole lot of words. So get on board, fasten your seatbelt, because we're going to go boom, boom, boom. Now you have a foundation, you know what's coming up. You know we're going to be going through a lot of words, okay? And you will have access to this. You can rewind, pause, forward, right? And do this and learn it. And some of it may require repetition. You hearing it again and again and again and again. That's just the nature, okay? So now let's talk about prefixes. So you know prefixes changes a root word, right? And it's the beginning part. So free prefixes always appear at the beginning of a medical term and it changes it. It tells us the meaning of it, tells us what's going on. Okay, it's going to provide important context. So sometimes prefixes will tell us the location, the time, the number, the negation. It changes its meaning. So for example, if you see a word and you see the prefix hyper in front of the word, that means there's an above normal. We know everything in life has a norm, what we call homeostasis or therapeutic range, right? Everything in life, there's a normal, expected, therapeutic amount. When you see hyper in front of that, it means you are above the norm. Hypertension. Okay? Tension is dealing with blood pressure. Hyper, you're too much, right? Some of you have been diagnosed with hypertension. You have high blood pressure. Your blood pressure is higher than the norm, right? And the norm that you should memorize is 120 over 80. When we get into skills, we'll go over normal blood pressure. That's something that's coming up in the future. Okay? So hyper, above normal, tension, okay, create hypertension. Your blood pressure is high. Now, life is like this. There's a high, there's a low, there's a up, there's a down, there's a left, there's a right. When you know one, you need to know the other. So we just went over hypertension. You have to imagine there's a hypotension. Yes, there is. So if you see in front of the word tension, the word hypo, that means you're below the norm. So do you see how we just broke down three words? Tension, and if you see in front of tension, hyper, or if you see hypo, you'll know the meaning. So when we say tension, we talk about blood pressure. So now if I say this client is hypertensive, their blood pressure is high. If I say this client is hypotensive, their blood pressure is low. Here are some more examples of prefixes. When you see the word a or an in front of a word, it means without. Aseptic. Septic is sterileness, cleanliness. So this, if I say something is aseptic, that means it's autoclave, it's as clean as it's gonna get, there's no pathogen on it. If you see bi, that means two. Tri means three. So bifocal, right? Two. Some people wear glasses that are bifocals. Okay. Brady means slow. Cardia, we already went over that root word. Cardia is heart. Brady means slow. So that means your heart rate is slow. Brady, cardia. Now, if there's a slow, there's a fast. The fast is tachy, cardia. Your heart is beating too fast. When you see pre before a word, it means before. Prematurity, before you become mature. If there's a before, there's an after. Now I hope you get into my routine of teaching. You've got to learn the opposite. There's a left, there's a right, there's an up and there's a down. The sun rises and it goes down. You see what I mean? It's just how life is. So pre, before, post, after. Post mortem. Mortem is death. After they die. Okay? So recap. I like to recap. I like to repeat myself. So this slide was all about prefixes, right? Before the root word. A means without. By means to. Brady means slow. Tacky means fast. Pre means before. Post means after. Again, you may need to do a repetition where you go over this again and again. You will have access to this, right? Watch it, pause it, rewind it, do it while you're driving. There's an app to this site. You can download the app, it's free. Okay, and do this while you're on your jog. All right, so let's continue with root word, right? The core meaning. Okay, so root words form the core, the root. Without it, we have nothing. Okay, carrying the essential. Essential, without essential, what do we have? It's essential, we need it. Okay, and most root words in medical terms come from Greek or Latin, so they'll seem a little odd, right? Because we don't speak Greek or Latin. I know a few words, but very few. Okay, and they typically are referring to body parts, to colors, to function. Here's some examples. We already went over cardi or cardio, which means heart. Derm or dermite means skin. Gast or gastro, we see we put the vowel to make it a word because we don't have words without vowel in the English language. That's why we're adding these vowels. Hepat, that's liver. Hepatomegaly, nephro, that's kidneys. So you have to spend time with these root words because once you know you're familiar with the root word, then you want to get familiar with prefixes and then suffixes. Here's some more. Ereth means red, right? Erythro. Leuc means white. Leukocytes. Cyan, cyanosis means blue.
You're muted.
Okay, you should be able to hear me now. Nadine's muting me. So let me recap. Let me know when I'm muted, all right, everyone, because I'm not able to tell. A little message comes on the other side. But if I get accidentally muted from Nadine, go ahead and let me know. Nadine, you're awesome. All right, so just to recap, anatomical, root word, okay, heart, cardio, dermato, that's the skin or dermat, gast, that's stomach, hepat, that's liver, nephro, that's the kidney. So when you see these root word, it tells you what organ, okay? And again, there's a lot of root word that describe colors. Erith is red, leuc is white, cyan is blue, melon is black. Okay, obviously there's a lot more, but these are the most common ones. Okay, now we've done some examples of prefixes, we've done root words, so now let's do suffix. Suffix is the ending part of the word that changes its meaning, that adds meaning, okay, or completes a meaning. So when you see itis at the end of a word, it means something is inflamed. There's inflammation. When you see emia, That's a blood condition. When we say ectomy, something is being removed. Now, there are exceptions to this, but commonly, yes. When you see ectomy, okay, cholecystectomy, right? You've had that removed. To me, is an incision, right? A lot of procedures are done that way. There has to be an incision that is made, a cut. When you say logi, that's the study, right? The study of. What are we studying? When we see logist, like I said, like the example I gave you earlier, cardiologist, right? That's the person, the specialist, the individual. But if you just see logi, cardiology, that's just the study of that system. But if you see logist, there's a person, it's an individual. Okay? So suffixes at the end of medical term tells you what procedure, what condition, what's going on with the disease. Okay, lots of examples. The moment you see itis at the end, right, there's an inflammation, dermatitis. Itis tells you there's an inflammation. Derma tells you with what system? The skin. Because remember earlier we learned that derma means skin. So dermatitis means an inflammation of the skin. Ectomy, we know means removal. So if I say dermatectomy, that's a surgical removal of skin. Okay, so you see how we're just putting words together. And this is the beginning of you gaining that knowledge to be able to pass this test. Okay, now here's some more examples. This is with prefix. Remember earlier we went over a and an, and I gave you the example of aseptic. So that is free from infection, free from contamination. You don't get any cleaner than that. Okay, so that means whatever is aseptic, okay, has no bacteria, no pathogens, right? So we use that term to describe anything that is sterile, okay? Sterile medical environment or procedures. Here's another one, analgesic, a medication that relieves pain without causing loss of consciousness. So that prefix N, okay, tells you analgesic, pain causing. That's that root word, analgesic, creates a term for pain relief. So without pain. So the client is on an analgesic. Anoxia, the absence, because of the A, or severe deficiency of oxygen. Oxia, oxygen, which this condition is a life-threatening condition. We have to attend to that client. That makes that client a priority client. Okay, we need to medically intervene. Okay, we don't want clients being at an anoxia state and not address that, but we'll stick to prefix and suffixes for now. So further in our time together, we go into details with these, okay? So here's more prefixes. When you see ab versus ad, don't mix your B and your D, okay? AB is very different from AD. You have to learn to pay attention to details when you're studying, okay? AB, ab, means away, away from. So whenever you see the prefix ab, it means movement away from either the body, a location, but it's away, okay? Describes moving a body part away from usually the center, the core, okay? So abduction, ABD, not ADD, but ABD. Abduction is the movement of a limb, body part away from the middle part of the body. So if I take my hand and I move it away from my chest, I am abducting my arm, right? Away from the middle part of my body, abduction. Now the opposite, ADD means towards. So that's a prefix that indicates movement towards a position or location. So typically in healthcare, towards the body. Adduction, the movement of a limb body part to the midline of the body. So if I take my arm that I had abducted away from my body and bring it back towards my chest, that is now adduction. Abduction is away, adduction is towards. Okay? Don't mix them. Don't be taking the test so fast to where you don't see your B and your D. Slow down. Okay? Now, there's what we call anatomical prefixes. Okay? When we say anatomical prefixes, we're referring to specific body structure. NG or NGO, we're talking about blood vessels. So the client is doing an angiogram. That's going to give us a picture of their blood vessels. Usually we have them drink a dye so we can clearly see those blood vessels. When you see the word bronch, we're referring to the airway. Like you see in this picture here, this is the bronchial tree, which separates into primary, secondary, tertiary. But the word bronch, we're referring to airway of the lungs. So if I say the client has bronchitis, that's the bronchial tree. Itis means there's inflammation there. Bronchoscopy, bronch is the lungs. Oscopy is the visual examination of the lungs, okay, of that bronchial section. And when we say, when we say oscopy, we're using an endoscope. There's a tube going down the trachea into the bronchial tree for us to see, to visualize. So they had a bronchoscopy. Okay, recap. Bronchitis, bronch, the lungs, itis, inflammation. Bronch, the lungs, oscopy, visualization, right, with an endoscope. So we can do that and be able to tell if they have bronchitis. Okay. Now, positional prefixes. When you see NT, circum, it doubled here. So here, NT means before. So that means a position in front of, or if we're talking time, before in time. So if I say NT room, that's a room before another room. Circums means around. Circumference, around that area. Circumcision, that's a surgical removal of tissue around, like if a newborn has a circumcision, a newborn male baby has a circumcision, it's a cut, right, around that tissue of their penis to remove that foreskin. That's a circumcision. Removal of tissue around that specific organ area. So NT, before, circum, around. Okay? So, couple more. Sometimes NT will also be against, okay, or opposing, or prevents. Best example, great example you need to be familiar with is antibodies. Okay, so that's a protein produced by your immune system. We build antibodies, right, to pathogens that we've been introduced to, right? If you catch a cold, COVID, right? Measles, mumps, rubella, whatever, you catch something, you build antibodies. So those anti against, right? Antibodies will work against whatever pathogen your body was introduced to fight. Here's another example. NT, right? Against psychotic. Antipsychotic. So those are medications that we use in psychosis with clients with mental illness. So if there's hallucinations, delusions, mental disorders, those medications are antipsychotics. Anti against psychotic, okay, mental disorders. So anti sometimes means against or opposing. But if you look here, it also sometimes means before, but it's with an E versus with a I. Okay, so you'll see anti sometimes, right? Antipsychotics, antipsychotics, antibodies, antibodies. It depends, but just pay attention to the I and the E. It's the accent, right? So depending on where you're from, you're pronouncing it antibodies, okay? Or you could say antipsychotics, but just pay attention whether we're doing an E or I, okay? Now, couple more. Bi. Earlier I told you bi means two, okay? As in somebody who wears glasses, bifocals, okay? Two different prescriptions in that eyewear. So bi just means two, okay? Bicuspid valve, two cusps. The heart has a bicuspid valve, also called the mitral valve of the heart. So that bi tells us that there's two structures that we're dealing with. If I say they have a bilateral, both sides, they have a bilateral infection. So the infection is on both sides. So remember that prefix, bi. Combined with lateral, which means sides. So they have a bilateral infection to their lungs. So both lungs, both sides are infected. Great example for the root word bi. Okay. Brady and tacky. Brady, too slow. Tacky, too fast. Now, how do we know it's too slow or too fast? Because we already have a range. We already tell you what's normal and what's abnormal, right? We want heart rate to be between 60 and 100. So anything below 60 is too slow. That's bradycardia. That's an abnormally slow heart rate. And then there's tachy, which is over 100. That's an abnormally fast heart rate. I'll mute everyone. Okay, so let's go to the colors now. We just talked about how there's root word that tells you colors. We said erythro's red, Luc, or sometimes it's with a K, sometimes with a C, is white. Melon is black or dark. Cyanin is blue, okay? And like cirrhosis, is that red-orange color. So you see erythrocytes, that's red blood cells because eryth is red, cytes is blood cells, red blood cells. Leukemia is cancer of the white blood cells because remember, leuk means white, emia is the blood. Melanin is the pigmentation of the skin or hair. Cyanosis is the blue discoloration of the skin. Many children are born with acrocyanosis. Their fingers and their toes are blue. People who have damaged liver end up with cirrhosis, which gives them that red-orange color. So you see, all these root words, these prefixes, when we see them in front of root words, tells us what color. Okay? So now let's talk about some disease-related prefixes. Okay? So carcin and cirrho. Carcin, whenever you see carcin in front of a word, that's cancer. Okay, so that prefix tells you they're dealing with some type of cancer, carcinogenic. Okay, so it was a cancer-causing substance. Again, Greek word, carcinos, but don't worry about the Greek part. Carcinoma, right? A type of cancer that starts in the cells, okay, that make up the skin or tissue around that organ to cause that cancer, carcinoma. Cero, again, that red orange. So that's that prefix that refers to red orange color seen with cirrhosis, right? So a client has cirrhosis of the liver, okay, which scars their liver, causes a lot of damage, and that is prone to alcoholics. Those who abuse alcohol end up with cirrhosis. Whenever liver get damaged, hepatitis. Okay, itis tells you there's inflammation. Okay. So orange related, I'm sorry, organ related prefixes. So we've covered quite a bit so far. I'm just recapping all that we've done. And I hope this isn't too heavy or too, because there's a lot more. So cardio, okay, so we're talking organs, cardio or cyst. So with cardio, again, the heart, pertaining to the heart. Whenever you see that root word cardio, we're talking about the heart. Okay, cardiology studies the heart. Cardiogram is an activity or recording of the heart. Heart. Whenever you see cyst, we're talking about the bladder. Okay, it's pertaining to the urinary bladder. So pay attention to that. Cystoscopy, we're looking at, right? Scopy, we're looking at the bladder. Cystitis, cyst, the bladder is inflamed, right? That suffix itis, cystitis. So cyst is the bladder, itis is the inflammation of the bladder. Gastro, when we say gast, we're talking the stomach. So if we say gastritis, there's inflammation of the stomach. But if we say gastroscopy, we're visualizing, we're examining the stomach. Hepat, right? Pertaining to the liver, hepatitis. Itis tells you there's inflammation of what? The liver. Oma is a tumor, hepatoma. So there is a tumor in the liver. See, it's just breakdown of words, everyone. So that is the beginning of your foundation. You have to get used to, familiar with the meaning of words, and it's just a matter of breaking them down. So here's more examples of collaborative prefixes. Co. When you see the prefix co, it means with, together. We're joining something. Okay? Coagulation. So that is when blood forms a clot. It's the process where blood changes from liquid to gel, which is the clot. So that prefix co tells me that there's, a joining, a changing. So coagulation tells me that there's various clotting factors that's forming clot. And when clot forms, bleeding stops, but clotting is also dangerous. Here's another example. Comorbidity. So there's simultaneous presence of two or more diseases. Something is joining. There's a joining of two things. Morbidity, diseases or medical conditions. So there's clients who have comorbidities. So comorbidities could be hypertension, right? It could be a number of things, but it's the joining. The co tells me that there's a concurrent with another condition existing together. So pay attention to that prefix. Coagulation, comorbidity. Okay? Oppositional prefixes. Opposition is against, right? Contra. Something is opposing. We're against something. There's a pushback. So something is opposing, preventing. So when you see the words contra indication, So that is a specific situation where medication, drug, procedure, surgery should not happen, usually because it's harmful. It's contraindicated. We would not recommend it. A great example is aspirin being a contraindication in children, especially after they've had a viral infection like chicken pox, because it causes Reye syndrome, or some people will say Reye syndrome. That's a contraindications. A lot of medications have contraindications because after research, we see, yeah, that was not correlating. It's not good. Contralateral. Remember, lateral is dealing with the body. So when we say contralateral, we're talking opposite side of the body. So when somebody has a stroke, so let's say you have a right hemispheric stroke, it affects your left side of your body. Vice versa. You have a left hemispheric stroke, it affects the right side of your body. That would be a contralateral. Strokes affecting the left side of the brain may cause paralysis on the right side of the body. That's contralateral, right? Because normally we would think right side, left side, left side. No, that's not how strokes work. So that's a contralateral. Okay. Dent, you're familiar with this one. Dentist. Okay. So that's a healthcare professional who specializes in diagnosis, preventing, treating anything dealing with the mouth, right? Oral cavity or teeth. So dent comes from that word teeth. Now you combine it with tist, tells you that's that person, that specialist, right? They specialize in teeth. They're a dentist. Okay. When we say dental, we're talking about the industry, the organization, right, itself. So dental procedure, dental condition. Dentition, we talk about the development or arrangement or type of teeth in the mouth. Dentition, right? Complete dentition refers to having all teeth present in the correct position. Complete dentition. Okay, so that's all dealing with dental, which again, that's common. You're familiar with that one. Don't need to spend too much time on that one. Now, we already said that derm, okay, derma, we're talking the skin, okay? Skin, which is the largest organ in our body, right? We know we have the heart, the liver, but the skin is also an organ and it's the largest, okay? And when we say dermatology, we're talking about that medical specialty that focuses on the skin. If we say dermatologist, we're talking the individual. If we say dermatitis, there's inflammation of the skin. Dermatopathology, study of skin diseases, but in a microscopic level, right? Under a microscope where we can't see with the eyes. Derm, skin, toe, pathology. Awesome. Okay, hang in there. A little bit more to go. Dextra, right? So that dextra, we're talking right or on the right side when it comes to medical terminology. Okay, so conditions that happen on the right side of the body or rightward direction. So if you see the word dextrocardia, which is a rare condition where the heart is on the right side instead of the left. Okay, and it happens, it's rare, but it happens. But just that we use that terminology to teach you that prefix, dextro rotation, turning or rotate towards your right. Okay, dextro right side. Okay, easy one. Dye. When you see the prefix die or diplopia, okay, double vision, condition where single object appears to be two, okay? Die or indicates two, while opia is talking about vision. So double vision, diplopia, double vision. Diagram, or diaphragm. I'm sorry, diagram is another word. I didn't put that as an example, but that is an example. Diaphragm, okay, right underneath that chest cavity is that dome-looking shape muscle that's right under your thoracic chest after your rib cages. It's there to protect your abdominal cavity. We don't want that exposed, or um, if there's trauma, we need that protection. So that prefix dial, okay, means across or separating, which tells you that that function is divided, okay, between the compartments. So your abdominal cavity doesn't touch your chest cavity, right? Organs. It's protected by your diaphragm, okay? Dialysis. You're familiar with that term. That's a procedure, medical procedure that filters, removes waste from your blood when your kidneys can't do it anymore. People with renal failure, okay, need dialysis. So that dial, okay. So you see how depending on the word, it's pronounced differently. So like diplopia and then dialysis. So I versus it. But here for this example, we're talking dia means through, referring to the process where we filter the blood through, right? We're cleaning it. It goes through a filtration because your kidneys can't do it anymore, so we're doing it. But that's that second layer, dialysis. Okay. Diaphragm, dialysis. Okay. So dys, that means bad or difficult or abnormal or painful. Okay, that one has several meanings. Dysfunction, it indicates dysfunction, it indicates impairment, it indicates abnormal. We don't want to see that one. It's not a good thing. It means something is difficult, something is abnormal, something is painful. Dyspnea, you're having trouble, difficulty breathing. That's a problem. We don't want to see dyspneic clients or see you in dyspnea. You're having trouble breathing. So that's a very important prefix to be familiar with. Dysphagia. You are not able to speak. Difficulty speaking, producing speech. Happens often after a stroke or different types of brain injuries. Okay, so this is an important one. You'll see that frequently because there's many medical terminologies pertaining to that one. I mentioned ectomy earlier, right? We're removing something. That suffix tells us we're removing something. The root word tells us what we're removing. Hysterectomy. We're removing the uterus. You may have known some people who have had a hysterectomy. After they remove the uterus, they can no longer have children. Appendectomy, the appendix. Some people get it inflamed. They end up with appendicitis and have to have their appendix removed. So they went through an appendectomy. Cholecystectomy. This is root word for the gallbladder. In 2004, after my first son, I had a laparoscopic cholecystectomy. I no longer have my gallbladder. It was removed. Tonsillectomy. Some children, if they're prone to tonsillitis, they may have to have their tonsils removed. You tell them to say, ah, and stick out their tongue. You don't see any tonsils. They may have had it removed. It's not just children, adults can have a tonsillectomy too. It's just common in children. So ectomy is the removal, surgical removal, excision of, and that root word tells you of what? We're just breaking words down. Okay? Edema. When you see edema, something is swollen. Okay? So the rest of it will tell you what is swollen. Maxedema, swelling of the thyroid, due to thyroid deficiency. So somebody could end up with maxedema from thyroid deficiency. Or lymphedema, the lymphatic system blocks and causes edema. Pulmonary, the lungs. There could be edema of the lungs, pulmonary edema. Could be from accumulation of fluid, trauma, a number of things. But edema means something is swollen. Okay? Here's another one, emesis. When you see emesis, it means vomiting. Emesis, they're vomiting blood. Because remember, heme is blood. It's usually dark brown, coffee colored appearance. Serious problem, right? We never want clients vomiting blood, but it could be a number of reasons why that's happening. They could have gastritis, right? Itis, inflammation of the stomach. They could have a peptic ulcer or peptic ulcers disease. It could be their esophagus, esophageal varices, where the blood vessels are bursting. Hyper, too much, right? We already talked about that prefix. Hyper, too much. Emesis, vomiting, excessive, severe, above amount of vomiting. Some women, when they get pregnant, they end up with what we call hyperemesis, too much vomiting, gravidarum. Tells me this is happening during pregnancy. Hyperemesis, gravidarum. Hyper, too much, emesis, vomiting, when? While they're pregnant. Big problem, because then they're at risk of dehydration, electrolyte imbalance. We don't want to see that. EMEA, I've already mentioned that one. Blood problem, right? EMEA, we're dealing with blood condition. Anemia, you don't have enough. Remember the A. Bacteremia, you have bacteria in your blood. Glycemia, you have sugar in your blood. So emia, blood, but what's in front of it tells you what's going on. You see? That's foundation of what we're doing, okay? And again, you've got to go through this several times. The one time we do it together is not sufficient. Okay, it's just not. When you see hue, that means true, good, well. It's a prefix, indicates something good, something normal, something positive, euphoria. Okay? Opposite of what we just talked about, right? Remember, whenever there's a left, there's a right, up, down. We just talked about bad, so now this is good. Okay? So euphoric phase, right, is that happy, okay, euphoria, we're good, all is well. Pseudo means false or fake. Something appearing to be something that it's not. Pseudo pregnancy. So a woman may have symptoms that they're pregnant, but they're not actually pregnant. Okay, pseudo or pseud. There's a few more, hang in there. Extra, okay? Out, away, out of, not part of. So excision, I'm gonna remove it. Extra is outside of. Extra uterine, it's outside of the uterus. Extravasation, it's outside. Okay, find a way to remember that. X is removing it. You're gonna have an excision for us to remove extra uterine. It's outside of where it should be. Okay, so that's another prefix. Ginger and gloss. So ginger is dealing with the gums, right? Gingiva. right? Part of the teeth and the jaw, that area. Gingivitis, itis, inflammation of the gums. Okay, gingivitis, itis, inflammation of the gums, gums. Gloss pertains to the tongue. Glossitis, you have inflammation, because itis means inflammation of the tongue. It appears red, swollen, painful. It could be from an allergic reaction. You could have swallowed something you shouldn't have swallowed and causes you to have glossitis, inflammation of your tongue. Okay? And we teach patients to do, their dental check every 6 months, get your teeth clean, all of that good, healthy gum measures. We prevent, right, gingivitis with regular dental checks. All right, graphy, that's a suffix, graphy, okay? We're talking about a recording of or an image of something. Angiography, right? It's an imaging, okay, where we're using X-ray to visualize blood vessels, arteries, veins, whatever it may be, but it helps us see. A woman could have a mammography, right? So it's a special X-ray that helps us see the tissues of the breast, like mammograms, right? Mammography. So we do recommend regular mammograms, especially after you're 40, or if you have, a close relative, first degree relative, mother, sister with breast cancer, then the recommendation is for you to do that earlier. But the graphy part is the visualization, okay? So with the female reproductive, there's prefixes there too, OBGYN, GYN, okay? So whenever you see that, we're pertaining to specifically to the female reproductive organ, okay? So that prefix tells you, yeah, this is a woman's thing. So gynecologist, right? Gist tells you it's the individual, okay, that specializes in the study of women's health. Okay. Gynecology is the specialty, that medical specialty, right? They study the female reproductive system, anything to do with the vagina, the uterus, the ovaries, the breast. That's your OBGYN. Obstetrics, okay? So GYN, women study. Okay, this prefix heme, so hemophilia, hematology, hemoglobin, hemorrhaging, all dealing with blood, 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 blood. Hemophilia, we're talking about where the blood is not clotting the way it's supposed to clot. It's a genetic disorder you're born with. Hematology is the study of blood. Hemoglobin is specifically the oxygen carrying part of the blood. Hemorrhaging, you're bleeding out, excessive bleeding, but it's all blood, 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 blood. So that prefix heme tells you blood. When you see that, that's blood, and see what the root word in the suffix is to tell you what's going on. Okay? Hemiplegia, we're talking about paralysis, which is one side. If we say quadriplegia, we're talking arms and legs not working, they don't have mobility of. Okay, but hemiplegia is paralysis to one side. Hemispherectomy, rare surgical procedure where they remove or disconnect part of the brain, cerebral hemisphere. But hemi is half, 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 right? Hemianopia, half of the vision is lost. Okay? One or both sides. So half, half, half. That's your prefix. Okay, hemi means half. Okay. We talked about the liver already, right? Hepat means liver. Hepatitis means inflammation of the liver. Hepatology is the study of the liver. Hepato, there's a tumor. Okay, I have the repetition on purpose so you don't forget. Okay, hitter or home. Hitter means difference or differences. Otherness, not so much opposite, but there's a difference, or it's different from. So heterosexual is a person who is sexually attracted to people of the opposite sex. So girl, boy, they are heterosexual, right? A different kind. Homo means same, okay? Indicates sameness, similarity, uniformity. Homosexual describe a person who is sexually attracted to the same person, girl, girl, boy, boy. Okay, the prefix tells you hetero, different, homo, same. So what is the prefix telling you? Both of these suffixes or root word are the same, sexual, sexual, hetero, different, homo, same. Prefix, okay? So pay attention to your prefix to see what you're dealing with. Hydro, water, fluid, okay? Hydrocephalus, there's fluid in the brain. Hydration, you've taken in water. You're hydrated, which is essential for life. Dehydration, see D, you could die from dehydration. We must be well hydrated, homeostasis. Okay, like I have my water here, I need to drink it so I don't get dehydrated. Sometimes when I teach all day, that happens. All right. Hyper, hypo, you should be familiar with already. You see why I did the beginning part? I like to teach to where I repeat it because the repetition helps it stay in your long-term memory. Hyper, above normal. Hypo, below normal. Hyper, excessive, too much. Hypo, not enough, below. Hypertension, your blood pressure is high. Hyperglycemia, remember glyce is the sugar. Your blood sugar is high. Hyperthyroidism, the thyroid right on your neck. Okay, too much, overactive thyroid. Hyper, 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 hyper. The prefix tells you got too much. Now the opposite, hypo, not enough. Your blood pressure is low. Your blood sugar is low. Your thyroid is underactive. Hypotension, hypoglycemic, hypothyroidism. Okay? Hyster, again, the uterus. Hysterectomy, the removal of the uterus. Hysteroscopy, the visualization. Hysterosonography is that ultrasound so we can see the inside cavity. We get a nice detailed image with that one of the uterine wall, the lining. We can see if there's any fibroids or polyps. Endoscopy is more, the tube. We can still diagnose and visualize with that one as well, but it tells us the modality of how it's being done. Okay. When we see in that prefix, we're talking not or without negation, or sometimes within or inside a location. Here are some examples. Inorganic, not coming from the original living organism. Inorganic, doesn't have carbon hydrogen bonds, which would make it organic. So because we're talking medical, inorganic compounds like minerals and electrolytes are essential for us. But if we're talking opposite of that, we would say inorganic. Organic is that. Inorganic is not that. Infect. So An invasion, to invade or multiply within a host organism causing a disease. You see how within an infection, it has invaded the body. It has established themselves in the body. We don't want infections. Okay. Inter or intra. Inter is between. Intra is within. There's a difference. Okay. Inter, you're talking between two spaces or between two organization entities. When we say interdisciplinary, that involves multiple healthcare disciplines that work together. So nursing with nutritionists, with physical therapists, with occupational therapists, we are an interdisciplinary team. When we say intra, we're talking about positions, but when that same structure. Intradisciplinary, we're talking about the single healthcare discipline. So nursing. In nursing, we have certified nursing assistants. We have licensed practical nurses. We have registered nurses. We have advanced nurse practitioners. You see how it's all one discipline? Okay. So interdisciplinary is different from intra-disciplinary because of the root, I'm sorry, because of the prefix. Inter, intra. Inter is within multiple disciplines working together to take care of this patient. And intra-discipline is multiple healthcare providers, but within the same discipline. Okay, so pay attention to details. Inter, intra. Okay. All right. Ism. When you see ism at the end, that means a disease, a condition, a medical state. It also tells us pathophysiologically what's happening, what's abnormal. So hypo, right? Not enough. Thyroid, right? The thyroid. Ism. So this is a condition dealing with the thyroid, telling us they're not producing enough thyroid hormone. So the client has hypothyroidism, especially when they have these signs and symptoms. They're tired, they're cold, they're gaining weight, they're depressed. Signs and symptoms of hypothyroidism. Metabolism. Metabolism is life-sustaining chemical reaction in organisms. We need proper metabolism to live. So when we say metabolism, we're describing a normal process that our body needs. We need food, we need water, we need, right? Sunlight. Yep. So metabolism, ism, hypothyroidism. Okay, it describes a disease, a condition, a state. Could be good or bad. ISO. That prefix iso means equal, it means the same. So isotonic solution is a type of fluid that has the same equal concentration as body fluid. That is normal saline, 0.9% sodium chloride. That is an isotonic solution. Iso, that same prefix, metrics, is talking about length or muscle that remains unchanged. So we can have isometric types of exercises to where we're not extending, lengthening, changing the muscle. See, isometric exercises involves tensing the muscle without moving the joint. So we can contract and release. So we just, Kegling is a good one. We can contract our pelvic muscle, hold it, hold it, hold it, hold it, relax. That is an isometric type of exercise. Iso, equal, same, no changes are happening to it. Isotonic solution, same concentration, same gradient, same viscosity as body fluid. Iso, same. Itis, you already know that one. I started the whole lecture with itis, inflammation. The client could have tonsillitis, inflammation of their tonsils, appendicitis, inflammation of their appendix, arthritis, arthro is the joint, inflammation of the joints, dermatitis, inflammation of the skin. Okay? Itis. Luke, we already covered Luke, that white. So this is repetition, right? So at the end of this, you should be able to just maybe do a couple more reviews and then this sticks to your long-term memory, okay? White blood cells, right? Luke, white, white, leukocyte, white blood cells that are part of our immune system. Leukemia, type of cancer dealing with the white blood cells, characterized by abnormal increase in white blood cells because of the leuc. Leukoplakia, condition characterized by white patches on your mucous membrane, your mouth, your tongue. Leuc tells us they're white. Okay, leuc. We haven't done this one. Okay, lipo, but you're familiar with the term liposuction. So lipo or lipo relates to fat or tissue. Okay, lipos, fat. Liposuction is a cosmetic surgery where we are removing fat, whether it be from the stomach, the thigh, the butt, but you're removing fat. Lipoma is a benign tumor that has fat, because you see the LIP. Okay, so lip, lipo, fat. Logist, you're familiar with again, it's the specialist that's studying that area. Are they a cardiologist, a dermatologist, a neurologist, right? Gist tells you that is the individual studying that field. Okay, is it the skin? Is it the heart? Is it the brain? Okay, Log-G is the specialty, the medical specialty. Hematology, they study blood. Cardiology, they're studying the heart. Dermatology, they're studying the skin. Nephrology, they're studying the kidneys. Okay, that suffix tells you. Lymph, we brushed up on a little bit. You know, there is the lymphatic system. We have lymphatic fluid. Okay, so there's the lymphatic vessels that runs throughout our entire body. Great picture of that. Okay, we have lymph nodes, okay, which filters. So the client could have lymphedema, which is swelling caused by the lymphatic system being blocked. Okay, edema, we already went over. Swelling, remember edema means swelling, so lymph swelling in that system due to blockage, lymphedema. Macro or micro, we're almost done. Now, macro means large, long. Micro with an I is small. Macro, large size. Macroscopic. You can see it with your eyes, visible to the naked eye. We don't need a magnifying glass. We don't need to put it under a microscope because it's big. Macro. But opposite of that is micro, small with the I. So when we put something under a microscope, it's because it's too small for us to see it with our naked eyes. Bacteria are microscopic. We don't see them on our hands. But I don't know if you've ever taken microbiology where, you know, they have you assess, you know, what's on your dirty hands. Very interesting. but we can see it under a microscope, but we can't see that our hands are dirty with our naked eyes. Okay. Mammal, we've gone over already. Mammogram, right? It's a visual, it's an X-ray dealing with the breast. Okay. Mammary glands, okay, again relating to the breast. Mastitis, mast deals with the breast. Itis, there's inflammation of the breast. Mastitis happens, postpartum breastfeeding, infection, okay, due to an infection post with breastfeeding. Very painful, swollen red. Melon, we talked about already. Okay, that's a color, that dark, okay, dark black pigmentation responsible for the complexion of our skin. Melanoma is a serious form of skin cancer, derives from melanocytes. So we can tell when moles change, right? Color, appearance, pigmentation, growth, that we're dealing with a melanoma. So that's how you can tell, like, if there's a mole that, whether it's cancerous or not, we want to look at the edges, the pigmentation, the color, the size. Okay, but it's all dealing with that. The melon part, that prefix deals with the color. Meninge deals with the brain, okay? Refers to the meninges, the protecting lining of the brain. The brain has several protective layers, okay, in the spinal cord. So a client can have meningitis, which is inflammation of the meninges, the lining, covering of the brain in the spinal cord. Inflammation, see, inflammation, itis tells us, but inflammation of what? The meninges. What are the meninges? The covering, the lining of the brain in the spine. Okay? Or they could have meningioma. So that's a tumor from the meninges. Okay? Again, brain, spinal cord, very dangerous. We don't want that. We don't ever want to hear, yeah, somebody has meningioma. But next time you see that, you'll know. Metacarpus. So now we're dealing with the wrist, the hand, obviously, carpus, fingers. Okay, 5 metacarpal. So that whole meta, we're talking after or behind, referring to position where the bones are. Okay, metatarsus deals with the ankles, tarsus, and the toes. You've heard metacarpus. Very different from metastasis. So you see how you have to pay attention? So meta, right? But what are we talking about here? Carpus, the hand and wrist. Tarsus, ankles and toes. But when we say metastasis, we're talking about the spread of cancer. Okay, from one area to another. The cancer has metastasized. It has spread. Maybe it started in the liver, now it's in the bones. Okay, so don't mix those. Metacarpus versus metatarsus versus metastasis. Okay. All right, the nose, rhino, nase, nose, nose. So both of them be able to go interchangeably. Okay, so that prefix is referring to the nose, the nasal structure. Okay, nasal pertaining to nose. But when we say nasogastric, that's the route. We're going through the nose. So we could put a nasogastric tube in the, that goes through the nares, but it goes in the client's stomach, nasogastric, because it's going to end up in the stomach. So some clients, yep, have to have a nasogastric tube for feeding. So this just tells us what route we took to get to the stomach. Nasal, we went via the nose. Gastric, we end up in the stomach. Nasopharynx is the part of the pharynx right above that soft palate with the nares. Should have put a picture of that one here. Rhino, still the nose. Rhinoplasty is nose surgery. Rhinitis, itis, is inflammation of the nasal mucus. Rhinorrhea is discharge from the nose. If we're talking layman's term, we'll say you have a runny nose. But if we're talking medical term, they have rhinorrhea. All of it deals with the nose. Naso, nase, nair, rhino. Okay. Necro. Necro means dead, dead tissue. Necrosis, whatever it is, it died. It's been injured. It's failing. No more blood supplies. Okay. Necropsy, examination of the body after death, like autopsy, which deals with the dead, procedure on the dead body to study pathologically why they died. If you want an autopsy, that's the reason you would want an autopsy, so we can tell you what killed that person. But necrosis, it's dead tissue. Necrotic tissue is dead tissue. Okay, death. Nephro, kidney, renal. Nephrology, we're studying the kidneys. Nephritis, the kidneys are inflamed. Nephrolithiasis, they have kidney stones. Okay? So, neph, kidney, we could be studying it. It could be inflamed. They could have stones there. But neph. Nerve or neural nerve, that one tells you because it's almost a full word. Talking about the nerves. Okay, or the nervous system. Okay. Relating to affecting the nerves. Or neurosurgeon. Physician who specializes in surgery of the brain, the spinal cord, the peripheral nervous system, or the peripheral nerves. So that's a branch of medicine. If we say neurology, dealing with the brain, the disorders of the nervous system. Okay, nervous system or neuro or nerve, all the same. Neologism, I mentioned earlier. So that means new. Okay, recent, just happened. New growth. Neoplasm, abnormal growth. It could be benign, meaning no cancer, or it could be malignant, which means cancer, but it means new formation of tissue, right? New. That's what neo means. Okay, but is it, benign or is it malignant? Neonatal, newborn baby, right? New. You're new. You're less than a month old. Your first 28 days, you are called a neonatal because you're new to this life. Okay, new. Ocular or ophthalmo all deal with the eyes. Okay, ocular, meaning eyes, ocular, oculist, all eyes. Ophthalmologist, optom, still eyes. Okay, ophthalmology, somebody who studies the eyes or the study of the eyes. Ophthalmologist is the person. Ophthalmoscope, optom. So we're looking at the eyes. Scope, yep. Okay, so all deals with the eyes. Oculo, ophthalmo, all eyes. All right. All right, everyone. So that was all prefixes. I know that was a lot. All right, so the question I have for you is, did you learn? All right, so the question I have for you is, did you learn? All right, everyone. So I pray that you did learn and that this is beneficial to you. So just a reminder, please go ahead and practice the questions within this section and make sure that you are getting them correct. You're able to take them several times if you need. Please do that before you move on to the next section. All right, have a great day and God bless. Bye-bye.